So my name's Hayley Williamson. I'm a veterinary surgeon, and I work at the University of Nottingham as their clinical assistant professor in small and exotic animal practice. So I started off my career, I graduated as a vet and went into general practice. I didn't really know where I wanted to go, so I actually went into very generalized practice. So with veterinary medicine, it's usually split up into species, and some people will go into just small animal practice, which is mostly cats and dogs. Some will go into farm, some will go into equine, and some will go into a mix. And I actually did all of them. So I went into a practice that did small farm and equine, just to get a good basis, really. So I did that. And part of that practice was they had an exotics clinician, and exotics being sort of reptiles, birds, and some zoo animals and British wildlife. And I just gravitated towards them, and their job was really interesting, and every day was different. And so I actually ultimately ended up sort of working more with them. And then when they retired, I took over as the exotics clinician there, and then did some further training in exotics as well. So I started off working in practice doing a postgraduate certificate in zoological medicine. And then off the back of that, there was a brand new vet school that opened up just down the road at Surrey Vet School. And they approached my practice originally, asking us to host some of their students on their final year, where they just do placements and travel around different practices, which I signed up for. So I ended up working quite closely with Surrey, and then I ended up working there part-time alongside my clinical work. So that was my route into academia, which I never would have guessed. It was a bit of a surprise. I started to do some teaching here and there and actually really loved it. So I ended up, whilst I was there, doing actually 4 days at University of Surrey, 1 day in clinic. And that was a really good mix for me, and I sort of took over more academic things. I then became exposed to research just through marking student research papers and seeing academics around me doing research. And so actually I started looking at doing a PhD, and at the time I wasn't sure if that would be full-time, part-time, how that would really look. And so I sort of looked at all options, and my biggest barrier was funding. So I think with veterinary, it depends on what area you want to go into research. And I really wanted to do exotics at the time. And there wasn't really huge amounts of money looking available for doing pet exotic work. There was a handful of things looking at more conservation medicine, but it wasn't really what I wanted to do. I wanted to do more clinical exotics rather than field-based work and ecology. And so I essentially stayed there and just did some investigating. And then I became exposed to a completely different area of veterinary that I hadn't experienced before, called veterinary human factors. And that was just by accident, really, because we did some collaboration with the school of, so with the paramedics. And I went to go watch some of their immersive simulation because the vet school weren't doing anything like that at the time. And we were thinking about introducing some. So they kindly let us observe, and I became aware of this thing called human factors that we just weren't really that aware of in the veterinary world, but in medicine and engineering and aviation, is a big thing, and it was everyday vocabulary. So then I realised this was a big thing that was missing in the veterinary profession as a whole, not just Surrey, not just the practices that I worked at, but just generally across the UK, well, across the world really, and it was brand new. So I decided that I wanted to do my research there. And because it was new and it was so up and coming and it was so important, there was just a handful of people that were really doing research at the time. And so when I eventually moved jobs, so I relocated to Nottingham, and I went to Nottingham Vet School teaching exotics. Again, with the same sort of mix. I was doing 4 days, still doing 4 days teaching and 1 day in clinic. And I applied for funding within the university, and I'm now doing a PhD. So I'm doing that 2 days a week, and it's in veterinary human factors. So for me, my main active research area is human factors now. So mixed with pedagogical theories, and so that's teaching. So it's my personal research is mostly on how we effectively teach human factors. Human factors being how humans work, like a kind of psychology as well. It's about how we prevent but also deal with human error because it's inevitable. So it's like about putting processes in place to factor in that we're human, and that's down to the way we communicate in a team, but also the things we touch, the equipment that's designed, being a little bit foolproof, particularly when we're under pressure. So that's my main area, teaching undergraduates, but also teaching postgraduate and qualified vets in practice. But I'm also interested in the application of human factors within practice, which isn't my focus of research, but I'm around people who are looking at sort of how it's currently being used or not being used in a lot of cases. But I'm looking at particularly how we raise awareness and teach it. Alongside that, most of the student research projects that I'm involved in are exotics based, because that's my main job is teaching exotics and British wildlife. So I do have a handful of student research projects that are more how I envisaged my PhD being right at the very beginning of my career. So looking into therapeutics and different outcomes of different routes of treatment in British wildlife and exotic pets in practice. But that is more, I'm more of a supervisory role in that rather than actively the researcher. I think I enjoy the variety the most. I think it's the fact that I'm teaching, but I'm also in clinic and I'm also research, to being a researcher, it gives a lot of variety. The nature of my PhD as well really helps. I think it's important to note that doing a part-time PhD isn't easy and it isn't always right. It kind of depends on the person, it depends on the PhD. The exotics-based PhDs that I was originally trying to do wouldn't have been appropriate to be part-time. The PhD that I'm currently doing, because it's actually based on teaching, I can, when my teaching load gets really busy, I can sort of put it down for a bit and focus on the teaching. And then when other things get lighter, I can pick up PhD research again. And so it's suited for being part-time. I think it makes it all manageable and it makes it all more enjoyable. I think if it were a bit more intense and more field-based with very strict timings, I had to be in certain places and doing certain tests, it would just be a bit overwhelming. But I think the nature of me being able to put my different hats on at different times, and I sort of explain it to students, like the human factors is sort of not my main job, but it's like a really big passion and hobby. Whereas if I did exotics every day, all day, and then also on the side with research, I think it might become a little bit mundane or a little bit too much or just a little bit overwhelming. So the fact that I can have a little bit of variety, I really value. I think just time management, workload generally. There are periods where, exam times and marking periods where it's just completely, that's all I can really do is just do some marking. And I think it's important that I recognize that, and actually that's why I have a PhD that I can put down for a month or so if I need to. And I think at first I didn't quite get that right, and I tried to do everything, and I think you can't really. There will be periods of time where you just have to focus on the job that you have to do, and I think it took a little bit of adjustment and getting used to that. When I first got the funding approved, I was like, great, I can do this 2 days a week. Tried to then rule out 2 days every week in my diary, and then found out that's just not going to happen. It just needs to be as and when I can. And then, there will be periods, like for example in the summer, where I can do more of my PhD, and the moments where I would do less. I think it's a really exciting time to be a vet, because there's so much more funding available now than there used to be. I think your veterinary degree is often called your veterinary passport now, because it actually can lead you into lots of different types of jobs. It used to be that you graduate and you're a vet, and then when you're a vet for a certain amount of time, you then own a practice, or you take a management role within a practice. And actually now there's lots of different routes that you can go down. Veterinary research is one of them, and I think the beauty of it is there are, first of all, more PhDs available, more research type roles available, but also you don't have to stick with that one route. I think it's sometimes with other researchers, I get the impression that once you're in an area of research, you're in that box. I think with veterinary, everything's a little bit more, I wouldn't say collaborative, but more interconnected. So one thing can lead to another, and research skills generally are very transferable. I mean, I'm doing this, I'm sort of using the same skill sets to do human factors research as I am exotics. But I think there are less boxes, there are less categories, I think, because we have less clinicians who are doing specialties. Like, we have a lot more generalists. So we have vets that do everything. So they are, dentists, opticians, they are, medics, surgeons, everything. You do get a few that specialize and just do surgery or just do internal medicine, but it's much more common to be generalists. And therefore, I think the research field is very similar in that way. So you can do your PhD in a very small, narrow area, but then branch out from that. And I think that's really exciting, because if you experience new things, you can and get excited by different things, you can just very easily just hop on over and do that. So my research isn't so much about clinical cases, it's more about the human behavior of clinical practice. So it's a lot about how teams will communicate with each other, communication errors that can happen, and how then they ultimately affect patient safety. So I think the way my research has influenced my clinical practice isn't so much in helping me choose different therapies and treatment options. It's more about how I interact with people around me. So having now studied and done some research into different professions, so medicine being one of them, aviation, engineering, and psychology as well, the psychology behind human interactions, I kind of just understand people a little bit better. And I think generally, I think it's always going to be really positive for patient outcome. You obviously need to know which therapies and treatments to use, but you can get help with that. You can pick up the phone, speak to specialists and speak to colleagues. You can't really get help with the way you personally communicate and interact with the world. I think it has the biggest impact on me knowing how stress can affect somebody's, you could be the perfect communicator, you can do everything well normally, and then when you have a stressful day or just situation or case, everything can break down. And I think just situational and human awareness really, really changes how you perceive your role, your team, and I think general happiness and satisfaction in a job as well. So actually, I think my research has impacted everything, and that's why I'm so passionate about what I am researching, because I want every vet to experience that. Human factors is becoming, or has become actually, quite a common term for medics and human doctors, but go back a few years before the Martin Bromley case, and actually it wasn't really well known at all, and already it's starting to make big changes and waves within the NHS and how doctors work, and I really want that to happen in the veterinary world too. So that is my drive for my research, is it's changing clinical practice. I think it's this concept of identity within your job. I very quickly became an exotics vet, and that was what I was really good at, and that's what everyone told me I should do, and I loved it and I enjoyed it. But it got to a point where I had got my certificate and I felt like I had advanced as much as I could within being an exotics vet, and then I felt a bit trapped, like I couldn't, I had to go in to do residencies or internships, and there's only a handful of those in exotics in the UK, and I was thinking I was going to have to move to another country to do that, and I didn't want to, and I wanted to be a vet. I didn't want to go back and be an intern or a student again, and I felt a little bit like, well, this is it now. I'm going to do this till I retire. And it wasn't until I had the opportunity of a university approaching my practice for me to actually go, well, hang on, I'm good at this. I can teach this. I don't know if I'm a good teacher, but I'll give it a go. And then found out that I really enjoyed that too. And I think if that hadn't have happened, I'd probably still be an exotics vet. And there's nothing wrong with that. It's not just an exotics vet, but I think I would have found a little bit more, my role a bit more mundane, and like there's less career options and progression ahead of me, because I never wanted to own a practice. That wasn't something I was interested in. I was never really that fussed about business and those sides of things. So for me, I think it was accidental, but realizing that my identity is more than just being an exotics vet or even just being a vet. Actually, you can make your identity anything. And so now when people ask me what I do, I genuinely don't know what to tell them. Depends on the day. Sometimes I'm an academic, sometimes I'm a PhD student, sometimes I'm a vet. And actually, it took me a long time to become okay with that. I kept saying things like, oh, but I'm still a vet. Just because I'm not employed by practice doesn't mean I'm not a vet. Being one day a week in clinic, I had some friends raise an eyebrow and it's like, oh, so you're not really practicing anymore. And it used to upset me. Whereas now I'm like, no, I'm actually doing a lot more than that. And I'm actually having a lot bigger impact on the veterinary world, I like to think. So for me, it was the boxes. I didn't like being put into a box, and I did it to myself. No one else did. But realizing that you can do more than just be a vet. I love that question. Passion. I think whenever I get feedback from my students, I think being passionate about the topic can be really contagious. I teach a sort of satellite species. It's not a main species. It's seen as sort of a thing on the side. But I think over the last few years, that's become less and less an opinion. And I'm actually being, exotics are becoming more of a core species. And I think it's something that is just becoming contagious to students. They want to learn more. If you're excited about something, they want to learn more about it. And I think I approach it in a very day one. So the RCVS, our governing body, which is the Royal College of Veterinary Surgeons, have something called day one competencies, which are what they expect a new graduate veterinary surgeon to be able to do on day one. And because I'm not a core species, I focus my teaching on day one. So I keep it really relevant. Even if I'm teaching in year 1 or 2, I will use clinical examples and give them sight as to why I'm teaching them these things, and why in 5 years from now when they're vets, this is going to be really important to know, and to keep it interesting for them, and to see the benefit of why they're learning about these species and how it is going to be relevant to their careers. Even if they want to be an equine vet or a farm vet, learning about exotics is still really beneficial. So I think it's more passion, keeping it relevant, and allowing them to see the benefit to it, not making it too academic, and bringing in some clinical even early on. So that's a really interesting question. I think my career has already progressed, I think, beyond what I expected it would at this point. So I went into academia in 2018, so not that long ago really, and I'm now a subdean at the University of Nottingham, so I'm the exotics subdean, which means I'm very much involved in sort of not just teaching and delivering content now, but more curriculum mapping, curriculum planning, creating the learning objectives, and then asking deliverers to develop it. I'm also involved in creating our practice network. So in our final year, our students go out into different clinical practices in the local area. And so being a subdean, I'm involved in managing that network of practices and those relationships. And I think I see my career going more down that route. I think I'd always want to teach. I love teaching. It's kind of the thing that brings me the most joy in my academic career. But equally, I really like managing people, which again, I didn't know I liked. So becoming a line manager and going down the route of more management level decision making, I'm already on that trajectory and I'm really enjoying it. So I just want to go further into that, becoming head of department potentially one day in the very, very, very distant future. But I think, to be honest with you, I'm where I want to be for a while now. I've only just become a subdean, which is a fairly big jump up from being a lecturer essentially. And I think really with the academic pathway and promotions processes, if I want to get promoted to sort of professor level, you do need a PhD. So I wanted to do a PhD for several years before I knew that. So it's kind of fortunate that I've already started that. But I think having seen other colleagues of mine on the same route, maybe a few years ahead of me, I think if I weren't already doing a PhD, I probably would be looking to do one maybe in a few 5 years or so, because then to take that next step up in promotion and responsibility, in academia you do need a PhD.